Hello, everyone, and welcome to our conversations on conservation and animal welfare. Can you believe we're on episode 5 already? I know I can't. Anyway, today we'll be talking about the current pandemic with community animals in the region of Playa del Carmen, Mexico. The format of today's episode is going to consist of a brief conversation between Erika and I, followed by a question and answer segment at the end. My name is Sabrina Foley, and I am the Global Marketing Manager for IFAW. I am grateful to have with us Dr. Erika Flores, veterinarian and program manager for Latin America and the Great Caribbean, join us today. Welcome, Erika, and our special guest.
Hello, thank you so much for having me. Hello, everyone. It's a pleasure to be here. Thank you. And say hi, Moana.
Hi, Moana. And we're so excited to have Moana join us today. If any of you have checked your mailbox, you should have received this mail piece with Moana when we first got her. She's doing much better, and you'll hear her full story from Erika later. But Erika, let's go ahead and jump in with maybe some opening remarks.
Absolutely, thank you. Well, as these times have come into place, I know that everyone has been struggling in their own way, but let me talk to you and tell you about the community here, how they've been struggling from the pandemic. So, Playa del Carmen is a touristic destination, very popular. And for those that may not be familiar with it, we're just 1 hour south from Cancun. And this is the tropical Mexican Caribbean. And well, basically the main income of this area depends on tourism. It's about 70%. So when the pandemic started and the airlines decreased their flights and the hotels started shutting down and authorities declared a lockdown, then, well, many families, most of the families here that rely not just in their paychecks every week and who already are struggling and living very strict, like just very tight sometimes on a tight budget, they depend also on tips. So no tourists, no tips. And it was chaos. Like basically people don't know how to do anything else because tourism brings everything. So with the pandemic, the pets that they have, that they love, also started struggling. They struggled providing the care that they normally do, and they also were struggling in providing the food that they were able to buy before the pandemic. And so that's where we jumped in to help.
Wow, Erika, thank you for those opening remarks. And now that we know COVID-19 is and will continue to affect our lives in so many ways, we're all trying to acclimate to what this new normal may look like. To our viewers who may not know, Erika is on the ground living this day in and day out. So we wanted to share her stories of saving animals and what she sees and what she's going through with you. So maybe we can get a glimpse of what this new normal is going to look like in the wake of a pandemic, because the one thing we do know is that the work of animal protection must go on. So with that said, everyone who's taken the time to join us today, thank you very much. Erika, let's go ahead and get started. If you could go ahead and give our audience some historical background of the work that has been done in Playa and maybe how it's changed as a result of the pandemic.
Absolutely, I'll be very happy to, thank you. So historically, IFAW has been in the region for over 12 years. The work started in the island of Cozumel, which is just a ferry way. It's a 45 minutes ride, and it's just in front of Playa del Carmen. I joined the organization 10 years ago when the work there had already started, and it was with the Humane Society of Cozumel. So after that, and I actually moved here from Mexico City, and I paid a year ahead of rent but it was fantastic because I was still being able to work at Cozumel because it was just like so close. And the work in Cozumel started increasing because they are very good and they just didn't need us anymore. It's an island, so things are just like more contained. And being in Playa del Carmen as well, living here, I started looking into these animals that needed help. And I started rescuing some, of course. I mean, who can deny help to an animal that needs it? And I am a veterinarian, so I'm always been doing this. So I needed somebody, like a place to go and sterilize the dogs and the cats that I was taking care into, so they could go up for adoption. And that's how I met our fantastic partner, Coco's Animal Welfare. So it's been already 8 years since we started working with them. And I mean, if you're our supporters and have been with us for this time, you know that with your help, we were able to buy a van. So because transportation is very complicated with animals here, public transport won't take them. Taxi drivers now, some do take them, but at that time there were literally none. So the van provided the mean of transporting the animals into the clinic so they could be sterilized or taken care of and then go back to their families. After that, the small house that we were working from just got so small because so many animals needed our help. And so we were able 4 years ago to have this dream come true into a clinic that was able to triplicate the number of animals that we were helping. So now, I mean, just not now till 2020 because of the pandemic, but just before, we were helping no less than 12,000 animals every year, and on our best year and most busy year, up to 14,000. So Coco's team, as you can tell, they are amazing. We have we do amazing work together, and we've been helping this community. After the pandemic, well, things had to be a little bit tighter. Like we needed to provide care for urgent needs only because we needed to also take care of the health of our own, the staff members, right? So, and ourselves. So we had to decrease that into urgent care. And so you can have an idea, like from 40 or 50 patients that we used to see every day, about 25 or 30 were the numbers that we did on April and May. And we started with food delivery to support all those families that needed that help to keep their families together. And it has been a very challenging time, but also a very emotional one. And we are very happy to be able and have been able to support our community under these difficult circumstances.
Wow, Erika, thank you for sharing those numbers because they're pretty incredible. To be able to treat over 12,000 animals annually is extremely impressive. Can you talk a little bit about what that typical day looks like, if there isn't such a thing as a typical day for you?
Yeah, is there a typical? And I love it, to be honest. I do love the fact that never is the same. But, well, for example, I mean, an average day would start with seeing the patients that maybe stayed overnight and needed extra care. And then look into the patients that receive the patients from this day, like for example, today. So this morning we received the patients that needed urgent surgeries and that are in need to go to the operating room, and we started also with consults. So low cost and free consultations for those who can absolutely not even pay low cost, so they can keep their family members healthy. And a very particular patient today, she's a Chihuahua, 6 years old. She was diagnosed by another clinic with a pyometra, which is a condition of the uterus where an infection develops inside, and it's life-threatening. Like animals die from that. We sterilize normally, but we also take care of situation, and it can be life-threatening, especially if it's a very small patient. So thanks to our help, this dog was able to have her surgery right away, her blood tests as well, and an incidental finding, she had a bladder stone, a very large bladder stone as well. So everything was taken care of, and she is just much better. She's gonna feel better. I mean, like nothing happened in a week, and that family loves her very much. It's been with them. She has been with them for 6 years now, and they adore her. So that's the kind of stories that we're able to help create instead of a fatality, or just having to say like, I have to say goodbye to my family member because I cannot pay for it. It's so hard, and I'm very grateful that we are able to help those people and those animals that need us.
That's so wonderful, keeping the families together during this difficult time, because I know how much my pets mean to me, especially now more than ever because of COVID. Erika, you were talking about, the social distancing that needs to happen, and I imagine when you're dealing with a lot of animals coming in a high capacity, that you may have a limited staff or maybe helping hands to assist with some of these visits and procedures. Can you talk a little bit about some of that?
Yeah, it has been so challenging. I mean, we need to be focused on every minute that we are working with the animals and their families, so they can keep the distance that we are not able to have two persons inside the reception area. They have marks on the floor. They have their extremes, like one goes to the right and the other one goes to the left. We need to take the animal from them and have a quick story of what's going on, if everything's okay, what are their concerns. Then we are wearing these face masks and face shields or goggles, and our scrubs, and sometimes gowns if it's needed. And we are working on tropical weather, Mexican Caribbean, where tourists will have their bikinis and be on the pool and just having a great time. But this is our work and this is our everyday. So we don't have AC at that side of the clinic. The only side of the clinic that needs the AC is the operating room. So we're working under these challenging circumstances, and unable to have a sip of water even like from time to time, because it's so, you need to have a protocol for that. So we do, we extend the time, and sometimes we're aware that we're starting to dehydrate, to be honest. It's just sometimes, it happens. And animals need our assistance, so we also keep the appointments very sharply, which is very challenging for Latins as well. And we have people from all over the world living here, but it's also very challenging to have people being on time, getting their appointments. And we're just used to allowed to show up. And then we have the patients with us in the consultation room, and any finding that we need more information, we have to gentle put it in the floor or back into the carrier, and then go to the owner or the caregiver and ask what's going on. Did you notice this? How long has it been? It's so challenging. And I can tell that they also they are struggling so much to not being able to be with them and help us. And they do help us a lot. They hold their animals, they count their animals. And so we just work with that, and if you're gentle and calm with your patients, they will answer back. So most of the times we're fine.
Wow, Erika, I can't even imagine wearing all that clothing and masks and having a hard time breathing in the heat. And we all know, been to vets with our pets, and having that dialogue with our veterinarian right there and not having the opportunity to do that just adds this extra layer of complications. But I was just so happy to hear that one of the most important things for you is making sure that we're keeping that social distancing that is so important right now during a pandemic. Keeping our staff safe only means we can save more animals later, which is so important. Erika, can you talk a little bit about maybe some of other animals that come into your clinic, or is it primarily cats and dogs that are coming in? Give us a little more about that.
Yeah, absolutely. Well, primarily, yes, dogs and cats. That's the most, like about 95%. And then once in a while, we will have the rabbit. We will have other companion animal, like, non-traditional companion animals. We do get sometimes parrots and birds or other wildlife species. And we always work with the authorities. If it's pets, we want to educate that wild animals are never pets, and we are very strict on that. We do provide the medical care, but we work with that person so they can understand that that's not a way to go, and that's not okay for the animals. And thank God the rest of the animals are just, interactions with people, accidents that may happen. We provide primary care, and then we tell them to, or we can put them in contact with wildlife rehabilitators or what the authorities think is the best for those animals. And it's very exciting to have sometimes other species, as I love wildlife, and I've been, it's part of my developing, my career. So it's very nice to also be able to help other animals.
That's great, Erika. And I know our special guest, Moana, is with you, and I know her story is very close to your heart. Would you mind telling our audience about her story?
Yes, yeah, absolutely. I mean, so Moana, if you have that picture that you just showed everyone in mind, that day when we went to the Mayan community of Nuevo Durango, which is 1 hour and a half driving from where we are right now. It's even to the Yucatan Peninsula, like in the middle. So we've been working with that Mayan community for over a year, actually 2 years now. So it was May 2018 when we started working there. And we were called by Jaguar experts because there was a conflict between Jaguars and dogs in the community. Literally, there was a Jaguar that was preying on their dogs. And they were shocked. This had never happened before. And so we were called because it was not the first time that we addressed a community where things like this have happened. And we have been doing this project, Blue Houses, in other parts, and we just were going to implement it there. But because we have been working with them for so long, we wanted them to have some food for the animals. As we do visit every 6 to 8 weeks, we visit their community, we make sure that everyone's okay, and we address any welfare issues, animal welfare issues that we will see, if any, and just follow up with the community. It's part of our job. So we wanted to just give them, provide them with food for a little bit of time, because we knew that the authorities were about to lock down us and stop the highways and the roads to just authorities. Like, we were not going to be able to go there. And also there was the risk of, being asymptomatic and then having them get the disease from you. It was just too much of a risk. And we knew much less about the coronavirus back then, because this was at the beginning. So we were planning about like our trip to this community and dropping all this food, when one day before I received a call of help about a dog that was recently adopted that I had not met before. And they were talking about Moana, and she had been hit by a car, severely injured, and they were asking for help. So that was basically almost pitch dark the previous day. So next morning we just went for and buying the rest of the animal food, and we went there and got to meet this traumatized dog because she was screaming of pain. Put in a carrier, we gave her pain management, and we drove back to Playa del Carmen. She got a good night's sleep. She was sedated and like out of her pain. Next morning, when we took her to the clinic, we just decided that it wasn't the best to amputate the leg because of the injury, that it was just too much. And she was still a little bit fragile in her state. Like you could see that she was still traumatized. She was still like on shock about what had happened to her. And now she's like in Playa del Carmen, like with all these people that she didn't met before. And just a couple of days after and being in my house, because I've been fostering her, she started blossoming little by little. And now she's just a loving dog. She has been playing a lot with my other fosters. And so they are like in this puppiness phase, and they just have a blast. I mean, they are always making trouble and so happy, and I'm so thankful that she is able to cope with that. And dogs always felt that they are very resilient creatures. They just thrive. I mean, they take everything that has been wrong and they give you an opportunity, even if they have been neglected or cruelly treated. They give you an opportunity as a human being of like, okay, well, I'll trust in you guys again, and I'll see how it goes. So they are always thriving, and I'm so happy that I was able to be part of Moana's story.
It's such a happy story, and I think now we all need to have a story with such a happy ending, and Moana's little mohawk and eyebrows really bring out that happiness in everybody. And I just want our audience to take a step back, because Erika did say that Jaguars are eating dogs. That is not something you misheard. I know when I first heard it, I was like, I'm sorry, what? Jaguars were eating people's pet dogs? I mean, I get worried about my little dogs getting taken by a hawk in my backyard. So I can only imagine what it's like to be living in a community with a predator like a jaguar around, sneaking around my house like it's a buffet. So Erika, can you talk a little bit about how that's affecting your work in the region, and how, as an IFAW person, focusing on both animals, because like you said before, coexistence is so important.
Yes, well, incidentally, in the Yucatan Peninsula, and actually in the country, there have been other interactions and jaguars eating dogs sometimes, but nowadays it's happening more frequently. And all the people that love their dogs and that want them to be okay have been, just like having some bad feelings towards jaguars just because they love their dogs, right? They want them to be okay. And they, jaguars are impressive creatures. They are the top predator that we have here. And sometimes they also think that it can be a matter of safety for their, for themselves or for their children. And so that's where we come. Like, we need to make them aware that the jaguar is just there incidentally, that we can have some methods and strategies to decrease that and actually stop it, because we've been able to do that. And then that just give us a little bit of time so it can work. And well, jaguars are, to start with, they are facing extinction, and they are already surviving so many threats. And so part of our project is providing care for those animals, like dogs, cats, and any other animals that people have. And specifically, we worry about vaccines, because distemper is a vaccine that we can prevent distemper, which is a disease that dogs can have and can get. It's mostly fatal, and we want to have them vaccinated so they don't get the disease and they are not transmitting it to other animals, including wildlife. So, for example, distemper can be transmitted to jaguars, and even if we don't have bad interactions, it can stay on the environment. And if dogs go with their owners to, look at the crops and just have a quick walk, they can just leave. If they are ill with distemper, they can just shed the virus particles around, and this can be picked up not just by jaguars, but other wildlife. Just pellets and canids are basically the ones that are sensitive to this, and that can unfortunately develop distemper, and it's fatal. It's just an awful disease. So we want to make sure always in our projects to vaccinate everyone, to have chicken flea preventative, to deworm, and this is just part of the One Health solution and approach that we also have as an organization with all the animals in the communities.
I love that holistic approach that IFAW is so well known for, because it's so important to look at the big picture. I mean, vaccines aren't only important for the dogs and cats, but for the wildlife and the community. And we have so much more to talk about, but we are coming close to 7:30, and I want to make sure that our wonderful attendees have an opportunity to ask their questions. So at this time, I do want to invite all of our viewers to please go ahead if you have any questions for Erika or Moana. Please feel free to type them in the Q&A box at the bottom of your screen, and we'll do our best to get to it for today. If not, we will get back to you as soon as we can with our responses. So let's go ahead and see what we have. Okay, our first question here is from Jill. Jill, thank you for joining us. Jill is asking, what would happen to the animals if IFAW wasn't in the Playa del Carmen region? That's a great question, Jill. Thank you.
Yes, Jill, thank you. Well, to answer your question, there are animal groups everywhere in the world, right? Like even if we go on vacation somewhere. So I know that if IFAW is not here anymore, because what we normally do with projects or with other organizations is like we make them stronger, and we just want them to have a higher impact and a better impact in the they are trying to solve from the root. So this is part of our work everywhere, as we cannot be everywhere, and partners and people can, like other organizations can be, then we provide tools and advice so they can be better at what they do. And I know that if IFAW wouldn't be here in Playa, Cocos will still do a great job, maybe not quite as we've been able to achieve together, but I know that there would be. So that's how I feel about it.
So partnering for bigger impact.
Absolutely.
Thank you, Jill. I have another question here from Felicia. And Felicia is asking specifically, what are the biggest risks to jaguars in the area? Thank you, Felicia.
Thank you. Very good question. So basically, it's habitat loss and fragmentation of that habitat due to highways being built, the new developments, so people can live there. Another one, it comes like to affect about 10 individuals per year, and around, because sometimes we don't know how many are affected by it, but it's road accidents. So animals get also run over by cars, especially in highways. Then another one is, unfortunately, and this can be prevented, like just very simple by not buying stuff that comes from an animal. It's illegal trade. Hunting of these animals so parts can come and be part of the illegal trade market is one of the things that makes me the most sad, because these are just ornaments, and these ornaments were part of a majestic animal that was living, his life in the jungle. So this is very unfortunate. And the other one is conflicts with people. Basically, just conflicts either for the jaguars being preying on their domestic animals like sheep or any other farm animals. So those are the biggest threats for them.
So scary. Thank you for that response, Erika. We have another question here from some anonymous. Anonymous is asking, what is the incidence of heartworm positive dogs that you see?
It's a good question.
It is a good question.
If we take into account that not like the tests are not done on every dog, or that the requirements are not as you have them in the States or Canada, from what we diagnose, it can be 1 in 10, 1 in 10 dogs that can have the disease. We work a lot on prevention, we do, but it's never enough.
Never enough. I have another question here. See here, you guys are getting so many questions. Keep them coming. Another person, anonymous, is asking, is animal cruelty or neglect prevalent?
Well, I think that as in the entire world, I have not seen any country that has not, at least a single case of, even the most advanced countries. So we do have that. It's getting better at not just having the legal tools for it, but also ensuring that they are, being, that these legal tools are actually being applied and punished. So we have been involved in a couple, and in authorities, especially the that deal with this, before they didn't even understand how important this is to address and actually have a file and receive the complaint. Now we are with just this on January, we had this booklet for people to understand how to file a complaint, a legal complaint that has to do with with cruelty or neglect. So it has all the steps needed, because sometimes they wanted to have a complaint done legally, but they didn't have the proofs. They could not prove that that animal had been abused or something. So now we have that as a guide. And, the authorities, the state authorities were involved in, and they were going to pass it around to, all their people. So now it's much, much better. And if I compare this to 10 years ago when I started, I just arrived, it's so much better.
So progress is always, that's great. I love hearing that. We can only get better with hearing those types of things. Is incredible, Erika. Thank you for asking that question, and thank you for that awesome answer. We have another question here from Laurel, and Laurel is, this is a really great question. She's saying, please give some examples of how you are protecting jaguars and how are pets being kept safe. Thank you for that question.
So basically our Blue Houses project, what it does is we work with the community so they understand how important jaguars are. And it's very particular, but when these accidents, or these preying incidents happen, we come into the community and we provide things. We provide vaccines for the dogs, we sterilize dogs, we provide with blue houses, or with doggy houses. Now we are also building some enclosures, but it's not really just a house, but it's like a pen, so they can stay like a group in groups, and they can also just be locked if they are too stubborn to go out and still be around at night. And that has worked very good in a community that is near the beach, 4 hours south from here. And this is also preventing the dogs go and prey on and eat sea turtles' nests, the eggs of the sea turtles. So this is a win-win situation for everyone. I mean, the dogs are safe. They are in a good place to be. They are not, suffering or anything. Like, this is a pen, so air is coming in. They have everything they need there, and it's just during night. It's a lockdown just during night, and while the sea turtles are also nesting. So this is really just a win as well for the sea turtles.
Oh, the sea turtles. Thank you, Erika. I have another question here from Holly, and we're just going to have time for 2 more questions. We have so many, Erika, but we just can't get to them all tonight. Holly here is asking, what would you do if a client came in with an injured animal that will surely die without medical attention, but they only have a few dollars and the cost for animal care is much higher? Then what are they able to pay?
Well, we just provide the care. I mean, there's never time. Somebody has said, like, we cannot treat it. Maybe if we cannot pay even the medicine, but we always try our best. I don't recall at any time. So if they just have a couple of dollars, we will receive them. And they can also pay if whatever they can on long term. And we also look for support with donations if people can put in, so we can take care of that animal. Absolutely.
Thank you, Erika. It's so beautiful that you're able to do that, because it's just so sad that people can't afford it and things happen out of our control, and it's just so great that we're able to keep these families together. We have another question here. This is from an anonymous attendee, and they're asking, do you use a spay or neuter pill?
No, we always sterilize animals by surgery. We use the quick spay technique every time that we can with the patient, and this is something we have been doing it. Really, pills are not 100% safe. Injections are not 100% safe. So we do every time surgically.
Thank you for that. And that was a really great question. Thank you, Anonymous. One last question here from Linda. And Linda is asking, does IFAW bring dogs and cats to Canada, and I'll just add anywhere else, the US, to foster or adopt?
Very seldomly. Like, I can literally count them like in, I think that it was 3 or something. We normally the communities adopt their own dogs. We want the communities to have this sense of belonging, that they have proudness in their mods, in their local mods. But if the occasion happens when somebody falls in love, I mean, we have many people that live here in this area that are originally from Canada or the States. So yes, occasionally it happens that somebody falls in love with some dog at the distance or anything, because of this multicultural community that we live in, and then we, of course, let it happen, but we don't seek it. We don't look for it. We understand that the solutions that we're bringing to the community are working on them being better guardians of their animals, and that we can find just as loving homes and the best homes here as we can or we could in other countries.
Thank you, Erika, for that response. The community dogs are so important to keep in the community, and it very much resembles other work IFAW does with the northern dogs in Canada. So that was just a perfect question, perfect response. Thank you. And that's actually all the time we have for today. We've gone above the promised 30 minutes, so I apologize for that, but it was just such an amazing conversation, Erika. Thank you for joining us. And for everybody who's attending right now, if you'd like to learn more information and hear all the latest news that IFAW is doing on the ground to protect animals, please don't forget to visit our website at ifaw.org, and we look forward to seeing you for our next episode.
Thank you so much for your time here and for letting me talk to you about this amazing community that we live in and how we're dealing with the COVID-19 crisis and how you have been able to help us help them. So thank you so much, and very happy to be able to do this job because I love helping animals, and I happen to, just like my work demands, helping them. So thank you for everything and keep in touch. Thank you.
Bye, everybody.